Hello, everyone. Today I'm going to be talking to you about some non-traditional nurse roles that you can do as a nurse corps officer in the Navy. Maybe you are bored or you are just burnt out on bedside nursing, fulfilling the inpatient and outpatient nursing roles, and you just want to try something new and exciting. The Navy has some really cool non-traditional nurse roles that I will talk about in this episode. The first nursing role I'll talk about is en route care nurse. You attend a course called Joint En route care course and you get certified as an en route care nurse. You learn to unload and load patients into and out of an aircraft and out of vehicles while managing critical patients. You also go through a water survival class as part of this training. Typically, you will get en route care training if you are going with a Marine Corps unit or if you are getting deployed. Other than those two things, it's a little bit difficult to get into this course, and especially now with all of the COVID restrictions for going on TAD, it's even more difficult. But I always say just try, submit your request, say you want to go to en route care training and get certified, and you never know, you could get certified. Another non-traditional role that you can fill is serving with a Marine Corps unit. This one, you will get stationed in 1st Med Battalion, 2nd Med Battalion, or 3rd Med Battalion, and those are located in Camp Pendleton, California, Camp Lejeune, North Carolina, and Okinawa, Japan. So what do you do when you're with the Marine Corps unit? Well, on a day-to-day basis, it's more of an admin type job and a training job. With the Marine Corps unit and a med battalion, there are way more corpsmen than there are nurses, and part of your role as a nurse corps officer is to train your corpsmen. The corpsmen typically work at the battalion aid station, doing sick call and seeing the Marines and going through the medical records of the Marines and making sure that all of their immunizations are up to date and that all of the Marines are medically ready to be fully deployable. When you're with a Marine Corps unit, you as a nurse will be required to do clinical sustainment hours. So that means working at a hospital, but not like your regular shift hour work. You're not going to be working your normal, like what we do now, 3 on, 2 off, 2 on, 3 off type of deal. You will do maybe once or twice a month, and that's just to keep your skills up. You could do more if you wanted to, but you're really not required to. Another thing that you do with Marine Corps units are deploy. So it just depends on what is going on in the world when you're with a med battalion. You can go to a war-torn area, you can do humanitarian type exercises, anything. They're highly deployable units. If you're interested in flight nursing, there are a few flight nursing billets in the Navy. They are extremely difficult to get because there's so few billets. You have to have a critical care nurse background, so ER or ICU. ICU is preferable. And the billets are in Diego Garcia and Germany. And you go through SEER training and some other training before you go to flight nursing. I will say that if you really want to be a flight nurse, I would look more into the Air Force, because in the Navy, you don't really get to fly a lot. When you're stationed at your duty station as a flight nurse after the training, you're more going to be like a department head for a clinic and fly sometimes. There are also billets for ship's nurse. The thing about ship's nurse, and that blows my mind, is that I'm in the Navy. When you're in the Navy, you would think you would get more opportunity to be on a ship. However, The ship's nurse is another hard billet to get. It's another one where you have to have ICU critical care experience, and you have to be selected. It's not like you just say, hey, I want to go to the ship, and then they just pick you like that. No, you have to send in your curriculum vitae or your resume. You have to write a letter of intent. You have to get letters of recommendation. It's a whole process in order to be selected to be a ship's nurse. What does a ship's nurse do? So it's not like your normal inpatient bedside nursing, right? You are more in a leadership position, and it's a lot of training and administrative work as well. You can, however, work in the clinic on the ship and help see patients, but it's more the admin training role. So this type of ship's nurse that I'm talking about, you will work on an aircraft carrier. It's a huge ship, like a floating city. The other type of nursing that you can do on a ship is working on the USS Comfort or the USS Mercy. The Comfort and the Mercy are floating hospitals, basically. So if you're a nurse on those ships, you will do more nursing type jobs like inpatient care. So there is a difference. There's a ship's nurse on an aircraft carrier where it's more admin training, and then there's nursing on the USS Comfort and the Mercy, where it's like a floating hospital, and if you're an ICU nurse, you're working in the ICU. If you're an OR nurse, you're working in the OR, and so on and so forth. If you are interested in being a leader, and that is your entire job, there are leadership nursing positions like a division officer, a department head. You can manage people, you can manage programs. There are healthcare management positions that you can do. You can preside over maybe a quality management program, risk management, safety, infection control, and never even touch a patient again. And that's your job. Your job is leadership. If you are interested in teaching, you can work in the staff education and training department, and you can preside over programs and courses like your resuscitative programs like BLS, ACLS, PALS. You can be in charge of the TNCC program, EKG programs, any classes that the hospital or clinics offer. You can work there, and your sole job will be to train nurses, corpsmen, doctors in the Navy. Another non-traditional role is being a Joint Commission Fellow. So there's a program that the Navy can send you to called the Joint Commission Fellowship Program. In this role, you will perform mock surveys of all inpatient, outpatient, branch clinics. You'll provide expert consultation on hospital accreditation, compliance, and performance improvement activities. You get to travel to different military treatment facilities and conduct these surveys, and basically you are pointing out deficiencies that the military treatment facility has, and then you tell people how to work on it and how to correct the deficiencies. The last non-traditional role that I will talk about is the White House nurse. So obviously this is extremely competitive, and you have to have an ICU critical care experience background, with most preferably an en route care background as well. When you are a White House nurse, you will take care of the president and the first family. You will travel wherever they go, and you will coordinate care, make sure that there are treatment facilities or adequate support wherever they go, and obviously perform first aid if needed. So really cool billet, difficult to get, but not impossible. So as you can see, there are a few different roles that you can fulfill as a nurse corps officer that don't necessarily mean you have to be an inpatient or outpatient nurse. So I hope I gave you a little bit of insight and it motivates you or makes you think about some different things that you can do while in the Navy. And keep the questions coming, keep the comments coming. I love your ideas. I want to give you the information that you want to hear. And even if it's not Navy stuff, it could be nursing stuff or living in Okinawa kind of things. Whatever you want to know, go ahead and ask the question and I will see if I can do a video on it. All right, guys, that's all I have for this episode. I hope you all stay safe and well, and I will see you next time.